Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. In this video, I will be going over carboxyhemoglobin. Let's get into the details. Carbon monoxide binding to hemoglobin molecule is called as carboxyhemoglobin. Note that affinity of carbon monoxide to the ferrous iron present in the heme of hemoglobin, it is 200 times more than the binding of oxygen to the ferrous iron. So, carbon monoxide, it is going to go and bind to the same binding site like that of oxygen. So, there is a competition between oxygen and the carbon monoxide for binding to the ferrous iron of heme of hemoglobin. As it is shown here in the figure, so the first figure it shows oxygen binding to the ferrous iron in the heme of hemoglobin, whereas the second figure shows binding of carbon monoxide to the heme of hemoglobin. Although the angulation here, that is 121-degree angulation of binding of carbon monoxide to the ferrous iron, it is a non-favorable angulation. Still, with the non-favorable angulation binding, the affinity of carbon monoxide to the oxygen, it is 200 times. Now, how exactly carbon monoxide binds with the ferrous iron in the heme of hemoglobin? See, the binding process is, it is a covalent bond but a reversible binding. Although covalent binding happens, but fortunately, carbon monoxide binds reversibly. That means, if a partial pressure of oxygen is sufficiently increased, we can reverse the binding of carbon monoxide from the ferrous iron site and it can be replaced by oxygen. So, that's one of the aspects where we can use hyperbaric oxygen in treatment of carbon monoxide poisoning. Now, what actually happens when carbon monoxide bind to heme of hemoglobin? Binding of one carbon monoxide molecule to one of the four heme groups that are available in a hemoglobin molecule. As you know, hemoglobin has got 4 subunits. Each subunit has got one heme group. So that means 4 oxygen binding sites are there in a hemoglobin molecule. So carbon monoxide, by competing with oxygen, it is going to bind to one of the 4 binding sites of hemoglobin, and when it does that, the conformational change that will be going on in a hemoglobin molecule, it will lead to binding of oxygen with other 3 subunits, but only thing with higher affinity. Thereby, those 3 oxygen molecules are not released in the peripheral tissue. So, what carbon monoxide does is, it is going to make oxygen to bind with hemoglobin molecule with higher affinity so that it is not released easily to the peripheral tissues. That means hemoglobin will have oxygen while it go from lungs to the peripheral tissue, but it fails to unload that oxygen, and that's why it leads to hypoxia in the peripheral tissue. And also, because of binding of carbon monoxide to the one of the subunit of hemoglobin and other 3 subunits are bound with oxygen with such a high affinity, it will lead to left shift in the oxygen dissociation curve. That's why carbon monoxide shifts the oxygen dissociation curve towards the left side, indicating that the hemoglobin has got higher affinity for oxygen and it is not releasing, or it is not readily unloading oxygen in the peripheral tissue. This causes tissue hypoxia in carbon monoxide poisoning. Sources of carbon monoxide. Sources of carbon monoxide can be endogenous source and exogenous source. Endogenous source is as a result of hemolysis, because when the hemolysis goes on, when hemoglobin is coming out of red blood cell, so heme is separated from globin, and the heme, it is catalyzed by, so this heme oxygenase, it's going to break heme into biliverdin while releasing ferrous iron as ferric iron, and also there will be release of carbon monoxide, and that's the source of carbon monoxide. And this carbon monoxide may contribute to less than 3% of carboxyhemoglobin that is found in the blood. So that's an endogenous source of carbon monoxide. So increase in hemolysis will increase in percentage of carboxyhemoglobin that is found in the blood. What is the exogenous or pathological source of carbon monoxide? So exogenous source for carbon monoxide can be carbon monoxide inhalation. There are variety of sources where carbon monoxide inhalation can happen. One is incomplete combustion of hydrocarbons, motor vehicle exhaust, exhaust from the generators and propulsion engines, ice resurfacing machines, house fires, fireplaces, wood or charcoal, camp stoves or lanterns, then cooking ranges, natural gas like methane, propane, kerosene heaters, furnaces, hot water heaters, gasoline powered equipment, propane powered forklifts, faulty air compressors, and then inhaling spray paint and cigarette smoke. So all these are the sources of carbon monoxide that can be inhaled. They all can lead to carbon monoxide poisoning. Other source can be methylene chloride. This methylene chloride, it is present in degreasers, paint removers, and it is metabolized in the liver, and in that metabolic process, methylene chloride will release carbon monoxide. And also, phenobarbital, phenytoin, and progesterone enhances carbon monoxide production. So these are the sources of carbon monoxide that can lead to carboxyhemoglobin. Now, normal findings for saturation of hemoglobin, it differs among smokers, non-smokers, and newborn. This is as follows. So in non-smokers, it is less than 3% of hemoglobin is of carboxyhemoglobin type. So it is COHB, carboxyhemoglobin. So the percentage of carboxyhemoglobin in non-smokers, it is less than 3%. Smokers will show less than or equal to 12% of carboxyhemoglobin. That's because smoke is one of the, cigarette smoke is one of the source of carbon monoxide. And the newborns will show little more than or equal to 12% of carboxyhemoglobin. That's because there will be hemolysis going on in newborns because of breakdown of red blood cells to replace fetal red blood cells with adult red blood cell. So physiologically that is going on, so that leads to increased presence of carboxyhemoglobin in them. And possible critical value of carboxyhemoglobin is more than 12%. And that's when carboxyhemoglobin can lead to signs and symptoms. Now let's move on to see mechanism of carbon monoxide toxicity. 85% of the absorbed carbon monoxide, it binds with hemoglobin and the rest is taken up by the tissues. Binding of carbon monoxide with hemoglobin and other heme-containing proteins like myoglobin, cytochromes, NADH oxidases, it will disrupt normal physiological processes including mitochondrial dysfunctions. Binding of carbon monoxide to hemoglobin causes increased binding affinity of oxygen to other three binding sites, as I have explained to you earlier. And this leads to decrease in release of oxygen from hemoglobin that will lead to tissue hypoxia. And the tissues with highest oxygen requirements are the ones that are worstly affected in carbon monoxide poisoning. and they are heart, brain with a profound impact. Now, carbon monoxide binding to cardiac myoglobin with even greater affinity, and that will lead to myocardial depression and hypotension, and that again exacerbate the tissue hypoxia, which is already caused by the hemoglobin not releasing oxygen in the peripheral tissues. Carbon monoxide can produce direct cellular changes involving immunological or inflammatory damage by a variety of mechanisms, and that may include binding to intracellular proteins like myoglobin, cytochrome A3, that is the fourth complex in the electron transport chain, or it may lead to like nitric oxide generation leading to peroxynitrite production. Carbon monoxide poisoning may lead to lipid peroxidation by neutrophils. It may lead to mitochondrial oxidative damage, apoptosis, immune-mediated injury, and delayed inflammation. And thereby carbon monoxide may also cause a brain lipid oxidation, leukocyte-mediated inflammatory changes in the brain that results in edema, focal area necrosis, and also typically the bilateral globus pallidus can undergo necrosis. And also carbon monoxide may cause direct toxic effects on myocardium. So these are all several ways that carbon monoxide can lead to toxic effects on our body. Not only carbon monoxide by increasing the oxygen affinity of hemoglobin by binding to one of the binding site of hemoglobin. Apart from that, as you have seen, that carbon monoxide has got multiple other effects in our body, overall leading to the carbon monoxide toxicity and metabolic changes. Now let's move on to see what are the clinical signs and symptoms of carbon monoxide toxicity. Symptoms typically begin with headache. That's the most common symptom of carbon monoxide toxicity. And also it may lead to dizziness, nausea if the carbon monoxide is around 10% of the total hemoglobin. And levels up to like 50 to 70% may result in seizures, coma, and also it may lead to death. Malaise, flu-like symptoms, fatigue, dyspnea on exertion, chest pain, palpitations, memory disturbances. These are the most common neurological findings that we see in carbon monoxide toxicity. Patients may also show confusion, depression, emotional lability, impaired judgment, hallucination, confabulations. Confabulation means patients will explain the events that have not or that have never been experienced by that particular patient or person. That is what is called as confabulation. Visual disturbances, syncope, seizures, stupor, coma, and gait disturbances, movement disorders, and also even the loss of teeth, that is loss of dentition. That is also one of the signs of carbon monoxide toxicity. Physical signs may include tachycardia, tachypnea, that is increase in the heart rate, increase in the respiratory rate, hypertension or hypotension, hyperthermia, cherry red skin, although a rare finding, like when you are cherry red, you are dead, that kind of sign. So cherry red coloration is because of the change in the color of carboxyhemoglobin from bright red to cherry red. And the ophthalmological findings include flame-shaped retinal hemorrhages with bright red retinal veins, which is a very sensitive early sign for carbon monoxide toxicity. The diagnosis is done by determination of carboxyhemoglobin. So elevated levels of carboxyhemoglobin helps in the diagnosis. Either arterial or venous blood can be used for testing carboxyhemoglobin, but most preferred is the arterial blood. And carboxyhemoglobin saturation using pulse oximeter can be used for screening, but blood levels of carboxyhemoglobin should be always be measured for confirmation of carboxyhemoglobin, that is carbon monoxide poisoning. Elimination of carbon monoxide by the body. Elimination of carbon monoxide occur predominantly via pulmonary circulation through competitive binding of hemoglobin by oxygen, and the rate of elimination is proportionate to the degree of oxygenation, atmospheric condition, and also a minute ventilation. Because half-life of carboxyhemoglobin in an individual in the breathing room air is approximately 300 minutes. So that means it takes around 300 minutes for carboxyhemoglobin to be eliminated out of our body. So especially in a normal room air or a breathing in a room air. Treatment involves immediate removal of victim from the source of carbon monoxide exposure so that additional carboxyhemoglobin formation is prevented. With high flow oxygen via non-breather mask, it reduces the half-life of carboxyhemoglobin from 300 minutes to 80 minutes, and with hyperbaric oxygen at 3 times the atmospheric pressure, the carboxyhemoglobin elimination half-life can be reduced further from 300 minutes all the way to 20 to 30 minutes. And hyperbaric oxygen may improve tissue oxygenation by bypassing the normal transfer of oxygen through hemoglobin. Thereby, a tissue hypoxia can be addressed by using hyperbaric oxygen. Not only that, hyperbaric oxygen, it leads to competition with the carbon monoxide in replacing carbon monoxide from its binding site on hemoglobin molecule. The clearance of carboxyhemoglobin in methylene chloride poisoning is prolonged because methylene chloride detoxification process is one of the source of carbon monoxide. So, if there is a concurrent methylene chloride poisoning and carboxyhemoglobin treatment is going on, so it might lead to prolongation of carboxyhemoglobin's half-life, and that might take more time to clear all the carboxyhemoglobin because of the continuous production of carboxyhemoglobin because of methylene chloride detoxification process. And also co-intoxication of cyanide along with carbon monoxide, it may be treated with sodium thiosulfate with 12.5 grams intravenously. And along with that, a cyanoKIT, that is hydroxycobalamin, can also be used to treat cyanide poisoning along with hyperbaric oxygen that is used for treatment of carbon monoxide toxicity whenever there is a co-intoxication. So this is all about details on carbon monoxide poisoning that leads to carboxyhemoglobin levels at higher concentration, giving rise to so many signs and symptoms because of the excess levels of carboxyhemoglobin in our body. Thank you.